Hi, everyone. Had a really interesting question this week from one of my clients. And then after talking to Miranda and Carrie Ann, they also have received this question as well. And it's, how does posture therapy work with other holistic therapies like chiropractic care, acupuncture, physical therapy, and massage? Anyone want to take the handle first?
Well, I will. And I will say that this is probably a top question for very new clients or people who are just calling to find out because they want to know if it's okay, right? And that's an amazing question to ask because some people, some even trainers will say, hey, if you're doing my thing, don't do anything else. And I think as a company, we probably don't have a rule around that, but I certainly think that yes, you can do all the modalities. I tend to think that we work really nicely with chiropractors because they push the bones into place and then you need to, solidify that with the muscular work. If you're someone who is in an extreme 9 out of 10 amount of pain, you will get a more immediate, like in that moment, relief by having your bones pushed into place. And then you need to not just, go and see him every 3 days. You need to then go home and do the routine that you get from us that is going to train your muscles to hold that bone or those bones in that position. And so I think that that modality especially it just works really well with us. Now, if you're somebody who's been coming to us for a while, you probably don't need to see your chiropractor anymore. That's also something that's pretty common. The longer we have people, the less they see their chiropractor. But I think that's a sign that, what you're doing is really, really working and your muscles are really firing. And, stuff happens. You might need to go see them. So I think for emergent care, if you're in a lot of pain, chiropractic, yes. And I think the same can be true of a massage. Sometimes, I mean, I'm a person who I go every 4 to 6 weeks and get a massage just because I work out a lot and I need to loosen up my muscles. And I do my routines every day. I do stretch and strengthen and do all the things, but the fascia in your body, it's like wearing a nylon of connective tissue. And so sometimes things just get caught up in there that it is very helpful to get massaged out. How about what you gals?
Yeah, well, I think it's great that you brought up again, kind of like the coexisting of these other practices. So especially chiropractic. So very similar. A lot of my new clients will still continue to see their chiropractors. In addition, I tell them the same thing, like, yeah, muscles are what move bones. They're physically moving the bones. The more you get functional, so the more you're working those muscles, the longer those adjustments will stay. And I have noticed also with like longer term clients, they're not seeing their chiropractor as much, but they work very good together because we're both trying to do the same thing. And then massage said as an emergency thing, I need to get a massage if I'm super tight. So yeah, both of those points, those are cool things that I come up to with clients.
Yeah, same. I think you know, I encourage everybody if they're currently doing any type of, holistic to continue on and hopefully again, just similar to your clients, like taper off, where if they are seeing the chiropractor weekly, that it'll be then bi-weekly, once a month. Because it is a shortcut way. If your arm or something is out of place and if you can get it in place, then you'll have more range to actually do your exercises more effectively. And same with acupuncture and body work, massage. If the fascia, if the muscles are so knotted and twisted and tight that you need someone just to help work out those tangles, and also it feels good. I mean, I love massages. Just having that manual work done on your body, it can also be really healing, not just from a physical standpoint, but I'm not sure how you are or your clients are, but whenever I see my chiropractor or my acupuncturist or massage therapist, I'm like, time for me to like dump all my world's problems on them and get my emotional things out at the same time as now I'm open these meridians, these energy lines in my body. Now I'm getting like my collarbone into place or something. So it kind of helps for me overall in that holistic sense of here's my emotional like dump, as well as my body is becoming in a better alignment. So
Yeah, and Miranda and I forgot to mention acupuncture, and so I'm glad you did. And that the meridian lines are huge there, and that it's almost like an opening, right? It's almost like acupuncture is giving your body this outlet to let something go that you've been holding on to. And so it is really interesting that, you know, somebody could be working with us on their shoulder and they get something, you know, a release in their foot, and then all of a sudden they're like, you know, all that work in our shoulder, I feel it moving now. And so they really do go along quite nicely. And for me as a therapist, I will sometimes use what their chiropractor says, or their, you know, I guess, how often they're going as how am I doing, right? Like if somebody has been seeing a chiropractor for years and they're like, oh, I'm always twisted, and they always have to, you know, put me on the blocks and get me back in place. I love when they come in after 6 weeks and they're like, you know, my chiropractor says my hips are good. And like, I just don't know what to do there anymore. And so I think, for me, I think it's really nice. And we do have a few acupuncturists and chiropractors, and massage therapists that, like, at least in Boston, we refer out to. So we have a relationship with them so we can kind of talk about the things we see in their bodies. And I encourage that with people too. Like, you need to think of us and your people as like your team keeping you going, right? We're your pit crew, and anybody wearing your jacket, like, they should be able to talk to each other and really work together to make the best you that there is. So I am always happy when somebody says, hey, I'm going to see my massage therapist. Like, do you have anything I should tell them? Or, you know, do you want her email or his email? And so I appreciate that. And it's also a nice way for us to find really solid, you know, practitioners that we can then recommend to other clients. So I think we're all pro all the other people. Do we?
yeah.
Do we have any other thoughts? I think actually physical therapy was in that question
Oh
too.
yeah, physical therapy. Depending on your physical therapist and your insurance and what they're allowed to do, it really complements with what we do, because at physical therapy, they can do also a lot of manual work. They have a lot more availability to equipment, TEMS, tables, like what are those called? Those full leg boots that you can wear that are ice.
Oh, yeah. The
Oh, yeah.
compression.
The compression, yeah, compression, like things that we don't have here. And, you know, everything that can take a step forward in your health, you know, again, with physical therapy, depending on your therapist, if they're only working, for example, on your knee, like, well, what about the rest of your body? That's when it works great in conjunction with us, because then we're going to address your hip and the shoulder and things that were contributing to that knee issue, you know, in the first place. So it's a great compliment to have us working together. And if there is communication, that's even better.
Yeah, I've had a lot of clients who would like new clients that would start out and they're like, can I keep doing my PT exercises along with what we're doing here? And I say, that's absolutely great. And I love that there's communication so we can actually talk about, well, what are you doing with the PT and how does that fit into what we're doing here? Whether that means we integrate or whether it's you do one before the other, but still maintaining that there's still benefit coming from doing those specific PT exercises, but just making sure that your body is aligned when you're going into that.
Yeah, I think for sure, thinking about order of when you do things, in general, you do want to do your routine you get from us before you do activity, just because it puts you in the best spot. But if I know you're getting a massage, say, I might have you do a certain amount of things before the massage, and then I might want you to actually reactivate a few things after a massage, because sometimes massage can just let it all go. And if like we're really working on, I don't know, anything, your glutes, your rhomboids, whatever it is, and you've just really had them all released, you just might need a couple exercises
Yeah.
post massage to turn
Mhm.
things on again and to move, because a massage also, like, they're an hour usually, or an hour and a half if you're very indulgent. And then like they can work on some tension that might be there for, depending on how often you go, like, 6 months. And if time is up, time is up, and that's all still sitting there, you might actually really need to move through that joint or muscle a little bit, just so that the junk that was released doesn't just go other places or sit back down. The worst is to get a massage and feel great for one day and then have a complete like relapse the next day.
Mhm.
So if you are doing other modalities, tell your therapist, because we can make some really great and helpful suggestions so that everything works together.
Yeah, and I think that's one of the wonderful things about what we do is we can work around any kind of feedback that you're giving us, any other modality, as long as you're just communicating with us. We can ensure that everything that we're doing is customized to exactly your body and what your body is doing every single day or week or month, whatever it is.